Namaste बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH University, Jaipur. In today's lecture, we are going to discuss about Tetralogy of Fallot. This is basically a congenital heart disease which is characterized by four things. This is the anatomy of the heart, and you can see the numbers 1, 2, 3, 4, the heart, and the labeling on the right side of what number 1 denotes, what 2 denotes, 3 denotes, and 4 denotes. So number 1 is basically pulmonary stenosis, that is thickened narrow pulmonary outflow tract. Second one is thickened right ventricular wall. Third one is the ventricular septal defect. And the fourth one is the aorta overrides septal defect. I will again repeat. 4 things in tetralogy of Fallot. Tetralogy means 4. So 4 pathological conditions are there. Number 1, pulmonary stenosis is there. Due to pulmonary stenosis, there is thickened right ventricular wall because more pressure has to be applied to pump the blood. There is ventricular septal defect, and number 4 is aorta overrides the septal defect. Now, on the left side in the A figure, you can see the normal heart, the normal anatomy of the heart, how the blood flows through the heart. This you already know, the normal anatomy and the normal functioning of the heart. Now, in the second B part, we see the anatomy of the tetralogy of Fallot. In tetralogy of Fallot, there will be increased outflow in the aorta, and there will be partial obstruction or stenosis of the right ventricular outflow to lungs and pulmonary valve. There will be ventricular septal defect and thickened right ventricular hypertrophy. So, in tetralogy of Fallot, there are basically 4 main components. That is, number 1, mal-aligned ventricular septal defect. Number 2 is obstruction to the right ventricular outflow. Third is the aorta that overrides the ventricular septal defect. Fourth is the right ventricular hypertrophy. So we have malaligned ventricular septal defect. There is obstruction to the right ventricular outflow. There is aorta that overrides the ventricular septal defect and right ventricular hypertrophy. Due to the right ventricular response to aortic pressure via the large ventricular septal defect. The right ventricular outflow obstruction is the most often subvalvular, but may be valvular, supravalvular, or the combination of these. So, in case of tetralogy of Fallot, the right ventricular outflow obstruction is most oftenly subvalvular, that is lying below the valve, but it can be valvular, supravalvular, or a combination of these components. The combination results in an elevated right ventricular pressure and right to left shunting of cyanotic blood across the ventricular septal defect. Now we come to the etiology. The etiology is abnormal development of the bulbar septum, which separates the ascending aorta from the pulmonary artery. It normally aligns and fuses with the outflow part of the interventricular septum. Now, what are the clinical features of tetralogy of Fallot? The children are usually cyanosed. The children, because it is a congenital heart disease, so the symptoms will start appearing in the childhood itself. So the children are usually cyanosed with right ventricular pressure that rises to equal or exceeds left ventricular pressure. There are Fallot spells with child suddenly becomes increasingly cyanosed. The cause is the subvalvular component of the right ventricular outflow obstruction is dynamic and may increase suddenly under adrenergic stimulation and may become apneic and unconscious. Other features includes stunting of the growth, digital clubbing, and polycythemia. Now the clinical presentation. The children with Tetralogy of Fallot exhibit bluish skin during episodes of crying or feeding. They are characterized by a period of uncontrollable crying or panic with rapid and deep breathing, that is hypernia, deepening of cyanosis, decreased intensity of the heart murmur, limpness, convulsions, and rarely death. It is common in early morning, shortly after the patient awakens. There is prolonged agitation and crying are also cited as precipitants. There is also noxious stimuli, such as phlebotomy or a bee sting, or any circumstance which leads to the enhanced catecholamine output can precipitate a spell in susceptible child. A decrease in systemic vascular resistance, that is SVR, during exercise, bathing, or fever potentiates a right to left shunt and precipitates hypoxemia. In such cases, TED spells, the absence of heart murmur, is a worrisome indicator that pulmonary blood flow is severely compromised. Now we come to the investigations. The investigation in case of Tetralogy of Fallot includes the ECG, that is right ventricular hypertrophy. In chest X-ray, you will observe boot-shaped heart. This is important, boot-shaped heart. I will show you the figure in the next slide. And there is an echocardiography which demonstrates the aorta is not continuous with the anterior ventricular septum. So in the ECG, you will find right ventricular hypertrophy. In the chest X-ray, you will find boot-shaped heart, and in echocardiography, it will demonstrate that the aorta is not continuous with the anterior ventricular septum. So this is the X-ray showing boot-shaped heart in case of Tetralogy of Fallot. Now, how will you manage such a case? Such a case has to be managed surgically. So surgical correction of the defect of the pulmonary stenosis and closure of the ventricular septal defect prior to the age of 5 years. So this is very important because this is a congenital heart disease. So it has to be treated before the age of 5 years. Tossing shunt, that is anastomosis that is created between pulmonary artery and subclavian vein. And the prognosis is good if surgical correction is performed at an early age, that is before 5 years of age. This is block tossing shunt. So this was all about Tetralogy of Fallot. In the next lecture, we will be discussing about hypertension. This session is powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.